Broadcast is live. So, sir, can we start?
Yes, absolutely.
So, welcome everyone to today's Facebook Live session on decoding brain and spine surgery. Make it simpler and less complex by Dr. Anutosh Singh, Senior Consultant in Neuro and Spine Surgery at Metro Hospital in Noida. Dr. Anutosh Singh is a highly qualified neurosurgeon with 10 years of experience in brain, spine, and nerve surgery. He received training in apex medical bodies of the country like AIMS, BHU, and has completed postdoctoral fellowship in endoscopy for brain and spine. He has worked closely and been mentored by renowned national and international faculty in spine. Also, he has been trained in advanced neurovascular procedures at Fujita Health University, Japan. As an academician, he has presented papers and given lectures as guest faculty at multiple premier national and international universities. He has various publications to his credit. With more than 10 years of experience and expertise in the field, Dr. Singh will be delving into the complexities of brain and spine surgeries and how to make the process easier for patients and their families. This session promises to provide valuable insights and information that will help you understand the procedure better. So, without taking much time, I would request Dr. Anutosh to start the session. Over to you, sir.
Okay, thank you so much for the kind introduction. Okay, so today I'll be taking questions regarding minimal invasive techniques, its current role and application in the field of neurosurgery. So I'm ready to take questions. Can I have a question?
Yeah, sure, sir. So, first question is, sir, what is minimal invasive neurosurgery?
Okay. See, it can be compared with the guided missile technology, which is more target specific and has a least collateral damage. Similarly, the medical advancement, the techniques, the surgical procedures are far more accurate and precise. In easy language, it can be understood as a न्यूनतम चीरे या बिना चीरे के सर्जरी.
Okay, so next question is, what are the different types of minimally invasive neurosurgical procedures and does it have application in spine surgeries too?
Okay, see, brain surgery not only encompasses brain and spine, it also includes the peripheral nerve system. So, the pathologies of either of these systems, that is the brain, spine, and peripheral nerves, a lot of pathologies can be addressed in a minimum invasive way. जैसे कि बहुत सारे ब्रेन ट्यूमर्स हैं, खासकर कि पिट्यूटरी ग्लैंड ट्यूमर्स हैं, या सेलर की पैथोलॉजी है, या एंट्रिक्रेनल फ्लोर के ट्यूमर्स हैं, सीएसएफ लीक है. इन सबको हम लोग दूरबीन द्वारा, है ना, जो कि एंडोस्कोप है, उससे जो नेचुरल कॉरिडोर है, नोज के द्वारा ऑपरेट कर सकते हैं. इसमें एक्सटर्नली कोई स्कार भी नहीं आता. सिमिलरली ऐसे बहुत सारे अदर ब्रेन ट्यूमर्स हैं जो डीप सीटेड है या इंट्रावेंट्रिकुलर लोकेशन में है, इनको भी हम लोग एमआईएस टेक्निक से ऑपरेट कर सकते हैं. Coming to the other part of the question, which was whether it has an application in spine or not, absolutely yes. So a lot of spinal pathologies जैसे कि रीढ़ की हड्डी के ट्यूमर, फ्रैक्चर्स, डिस्क पैथोलॉजीज, शियाटिका, इनको भी हम लोग मिनिमम इन्वेजिव टेक्निक से ऑपरेट कर सकते हैं. पेनफुल कंडीशंस हैं जैसे कि कार्पल टनल सिंड्रोम, जिसमें हाथ में बहुत ज़्यादा दर्द होता है, या फिर ट्राइजेमिनल न्यूरालजिया में फेस में बहुत ज़्यादा अनबेरेबल टाइप ऑफ पेन होता है, या फिर सर्वाइकल पेन है, लंबर पेन है, इनको भी हम लोग एमआईएस टेक्निक से ऑपरेट कर सकते हैं. बहुत सारी डिस्क की पैथोलॉजीज ऐसी होती हैं जिनको अब हम लोग जो कि रीसेंट एडवांसमेंट्स हैं एमआईएस टेक्निक में, उसमें बिना टाके, जिसको स्टिचलेस बोलते हैं, उसके द्वारा भी एड्रेस किया जा सकता है.
Thank you, sir. So before moving ahead, I would request all the audience to जिनके जितने भी questions हैं वो अपने related to neurosurgery, related to brain and spine surgery, जिस भी तरीके का उनका कोई भी सवाल है, कुछ भी है, वो comment box में type करके directly सर से पूछ भी सकते हैं. So now coming back to the question, sir. Next question is, sir, how does minimally invasive neurosurgery compare to traditional open surgery in terms of patient outcomes?
See, gaining expertise is a long learning curve. But yes, in good hands, the outcome of a minimum invasive technique and a procedure, I would say it is at times even better than the open procedures. जो क्लियरली विजिबल जो उसके बेनिफिट्स हैं वो है कि आपका हॉस्पिटल स्टे बहुत मिनिमम होता है, मिनिमम ब्लड लॉस होता है, आप अर्ली टू रिकवरी होते हैं, सो द नंबर ऑफ वर्किंग डेज लॉस्ट एज अ होल इज लेस. Similarly, the cost of drug free, you become drug free early, so the cost of medications they also come down. So overall, in good hands, it has a better result.
Okay, so next question is, how has minimally invasive technology improved in recent times?
इसमें जो की डेवलपमेंट हुआ है वो एंडोस्कोपिक यानी दूरबीन की टेक्नोलॉजी में हुआ है. इसके ऑप्टिक्स बहुत बेटर हुए हैं. इसमें हम लोगों को एंगल्ड विजन भी मिलना शुरू हो गया है. और आपके अब तो लेटेस्ट एडवांटेज ये है कि इसमें थ्री डी टेक्नोलॉजी भी आ गई है. मतलब यू कैन एक्चुअली फील एज इफ यू आर ऑपरेटिंग थ्रू योर ओन हैंड्स. सिमिलरली जो माइक्रोस्कोपिक विजन है उसके ऑप्टिक्स काफी बेटर हुए हैं. वाइटम सिस्टम आया है. The essential part is image guidance, which is also available with us for a very long time now. और जो इंस्ट्रूमेंट्स हैं उनकी 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 जो टेक्नोलॉजी है वो they are specifically designed for different kinds of procedure. So overall, when they used in a combined fashion, you tend to give good results.
Okay, so next question is, can minimally invasive techniques use for complex brain and spine conditions too?
Yeah, absolutely yes. In fact, I would go to the extent of saying कि they make the complex surgeries far simpler. And philosophically speaking, if no surgery is done properly, so any surgery can become complex. So coming to the essence that you have to master the technique, which again I said it is a long learning curve, but in good hands, the results are overall fantastic. And yes, it is absolutely makes the complex surgery uh, looks very easy.
So next question is, how do patient selection and preparation affects the success of minimal invasive procedures?
See, I would say, see, it is, patient selection is the integral and the key part of the whole process. So it begins with a detailed patient examination. A patient has to be thoroughly examined, and there has to be a detailed study of the whatever imaging necessary has been performed on that individual. It is only after that one can devise a procedure that कौन सी सर्जरी कौन सी मिनिमम इन्वेजिव टेक्निक किस पेशेंट के लिए बेहतर सूटेबल रहेगी. और इसमें इसमें the key role is obviously the expertise and the experience.
Okay. So next, uh, how is minimal invasive neurosurgery evolving to address the unique needs of pediatric patients?
Pediatric age group has always been unique, and they have their own set of challenges. But yes, with the technological advancement, a lot of miniaturized instruments have come into play. We have endoscope which are thinner, and they also perform, apart from being thin, they perform equally good vision. So yes, there is an increasing role of MIS techniques application in neurosurgery, especially for the pediatric population, and a lot of procedures are being performed safely with these techniques for that pediatric population also.
Thank you, sir. Next question is, how is minimally invasive neurosurgery being researched to improve patient outcomes and increase patient access?
See, this is being constantly evolving branch of neurosurgery, and with advent of different kinds of visual tools, this is an ever increasing scope for it. A lot of research is being done. Some surgeries have been standardized till date. A lot of are under research. So I would say yes, there is plenty of work has already been done, but yes, a lot of work still needs to be done. But whatever things have been accepted worldwide, they have been standardized and they are being practiced here.
So that was the last question which I had, sir. And now I will take few questions from the chat box which we have received. So first question is, what is the success rate of the doctor of the procedure? Sorry, if he's for the patient if he is going to perform, is if he's going to operate. Sorry, because thoda sa.
See, it has to be, matlab, like one size of shirt doesn't fit all. So it starts from the basic process of understanding the problem of the patient. What complaint the patient has, firstly. Then the detailed study of the imaging available with us, or any other further imaging is required. So one kind of procedure cannot be performed for everybody. There are multiple options in the umbrella of MIS techniques. So which technique is going to be best suitable for that kind of patient individual depends. So that is how the interplay of expertise and experience comes into. So yes, I've done with all due precautions and adhering to the standardized techniques. You offer tend to offer very good results.
So next question which we have received in the chat box, sir. So many spine-related issues can be treated with medicine and physiotherapy. And if there are, what are the other non-surgical options available for the patients?
There are at present multiple pain injections available, which can target the specific pain generators. If one has an understanding which is the actually the origin of the pain, so they can be addressed with the pain injection techniques. Recently, some work has been done in Iranian countries and Iraq countries. They have come up with the gate channel theories, where peripheral injections can also be given to alleviate the pain, and they work wonders. But that needs to be studied further because that has not been accepted in current medical practice as of now.
Okay, so before moving ahead, I would request audience once again to जिनके जितने भी questions हैं वो directly chat box में या फिर inbox में मैं directly करके पूछ सकते हैं. And the last question which I had in chat box, how many days do we need to spend in hospital for neurosurgery?
It depends on the kind of pathology you have. Supposedly for discal pathologies, it is for us it is an outpatient kind of case. We admit patient in the morning and discharge them by the evening, and they are good to mobilize themselves immediately post surgery. So that actually depends on the kind of pathology you are treating. Supposedly it is an intracranial problem. Obviously, the hospital stay is going to be a little longer, but not as compared to the your traditional approaches. So definitely yes, less of hospital stay.
Thank you, sir. That was the last question. Any take-home message would you want to give?
The take-home messages would be these procedures are being done at our center, which is the Metro Hospital, and we have been doing it for a considerably long time with substantially good result. And I think more and more centers should take up these techniques rather than the traditional approaches.
Thank you so much, sir, for your time today, and thank you so much, audience, for hearing Dr. Anutosh and Metro Hospital. So, for booking an appointment with Dr. Anutosh, you can directly visit our website www.metrohospitals.com. So, thank you once again, sir. So, I'm now
Thank
ending
you for
the
having me here.